So, if you would not have this fever, you would die today.
Če ne bi imeli vročine, bi danes umrli.
The same is with a tumor. If you would not have a tumor and you can't burn down the sugar, you would die.
Enako je s tumorjem, če ne bi imeli tumorja, ki bi vam pač izgoreval ta odvečni sladkor, bi umrli.
If a fungus can grow very fast in your body and the tumor is not controlling it, you can die within a few days.
Če se vam glivice zelo razrastejo po telesu in vam jih ta tumor ne uničuje, lahko umrete v nekaj dneh.
So from evolution, it's better when you die next week.
Iz evolucijskega vidika je bolje, da umrete naslednji teden.
Because evolution wants that you have some babies.
Evolucija hoče, da se razmnožujete.
But in all the illnesses, you have a so-called symptom momentum. Symptom momentum means a own dynamic.
Pri vsaki bolezni je tako imenovan simptomatičen trenutek, ki je odvisen tudi od posameznika.
This means the same symptom which helps you today for surviving will kill you tomorrow or next week or next year or in 10 years. Like with lung cancer, maybe in 10 years.
Vsak simptom, ki je danes mogoče za vas dober, vas lahko enkrat v prihodnosti ubije.
Think about it. You have a fungus, a very dangerous in your lung. What is better for you? To get a tumor and die in 10 years? Or let the fungus grow and you die in 2 weeks?
Imate v prsih neke vrste glivice. Kaj je bolje, da umrete danes, oziroma v nekaj tednih, ali pa da dobite tumor in potem umrete še čez 10 let?
And what is the problem today in medicine?
Kaj je problem danes v medicini?
The problem is that all the doctors are seeing the symptoms only on the end of the timeline, not on the beginning.
Danes je problem zdravniki, da oni vidijo simptome šele na koncu te časovne črte, ne na začetku.
When you have fever, it gives you the doctor some antibiotics or some cold water to the legs that the fever goes down.
Če imate vročino, dobite antibiotike ali pa kakšno drugo sredstvo za zbijanje vročine.
And when you have high blood pressure, it will give you some beta blockers or things like this that the blood pressure goes down.
Ko imate visok krvni pritisk, dobite neka sredstva za znižanje krvnega pritiska.
But then the problem starts.
Potem pa se problemi začnejo.
So, what you have to understand is that when you are ill, be happy.
Razumeti morate, da ko ste bolni, morate biti srečni.
You know, many cancer patients, they're coming to me and say, Mr. Hermeise, I don't understand why I have cancer. Because in the last 10 years, I was not ill.
Mnogi ljudje, pacijenti pridejo k njemu in ko vprašajo, da ne razumejo, zakaj so dobili raka, ker so
I had nothing.
bili v redu.
I had no problems here, I was not cold. I felt for 10 years perfect.
10 let so se počutili popolnoma zdravi, niso imeli niti nahoda, niti vročine, nič.
They were not very healthy. They were totally blocked.
Vendar niso bili zdravi, bili so popolnoma blokirani.
Rudolf Steiner, the anthroposophical guy, said one day, if you don't have every second year fever, you are serious ill.
Richard Steiner je rekel, da če nimate vsake 2 leti, Rudolf Steiner, če nimate vsake 2 leti vročine, potem ste resno bolni.
So, when I understood this, I not only understood cancer, I understood nearly all the illnesses.
Na ta način lahko razumete ne samo raka, ampak praktično vse ostale bolezni.
Because the only thing you have to do is, you have to ask yourself, why?
Ker edina stvar, ki morate narediti, je, da se vprašate, zakaj.
So when you have a tumor in your body, you have to ask yourself, why do I have it? At that point, at that place in my body, at that time.
Ko se vam pač nekje pojavi tumor, se morate vprašati, zakaj se mi je tukaj pojavi. Zakaj se mi je točno zdaj in točno na tem kraju.
And when you have a high blood pressure, you should not go to the doctor and take a beta blocker. You just should think about, why is my heart making such a high pressure?
In ko imate visok pritisk, namesto da greste zdravniku po sredstvo za zbijanje pritiska, se vprašate, zakaj se mi je pač pojavil v tem trenutku visok pritisk.
Or when you have a very high cholesterol level in your blood, you should not go to the doctor and take some statins to bring it down. You should ask yourself, why is my liver producing so much cholesterol?
In če imate preveč kolesterola, ravno tako ni treba iti k zdravniku po zdravila, ampak se je treba vprašati, zakaj moja jedra proizvajajo preveč kolesterola.
But the problem in medicine is today the doctors are not asking anymore, why is my patient ill?
Ampak problem konvencionalne medicine je, da se zdravniki danes več ne sprašujejo, zakaj je moj pacient bolan.
Because the doctors get not paid for talking.
Ker zdravniki niso plačani za to, da se pogovarjajo.
So we can't blame the doctors that they are not good guys. No, there are a lot of good doctors out. The problem is the system.
Torej ne moramo kriviti zdravnikov, da se zaradi njih pač je zadeva taka, kot je. Problem je s sistemom.
In Germany, in an oncological hospital, a doctor as an average is speaking to his cancer patients 7 minutes and 36 seconds.
V Nemčiji onkolog s svojim pacientom govori 7 minut in 36 sekund.
Do you think he can find out in 7 minutes what's the problem with his patient?
Mislite, da v tem času lahko ugotovi, kaj je narobe z njegovim bolnikom?
So, after I understood all these things, I understood better what I collected already years before.
In ko je razumel te stvari, je gospod Hirnese ugotovil, da lažje razume vse te podatke, ki jih je nekako v preteklih letih zbral.
Because for 14 years now, I'm interviewing so-called final stage survivors.
Ker on že 14 let intervjuja terminalne bolnike z rakom.
These people were sent home from their doctors to die, and they didn't die.
Te ljudje so bili poslani domov, da umrejo, vendar niso umrli.
And I'm asking them, why are you not dying?
In on jih vpraša, zakaj niste umrli, zakaj
And I found out at the end, they're always doing only 3 things.
In ugotovil je, da so vsi od teh ljudi delali 3 stvari.
So it's changing the nutrition, it's doing detoxification, and it's an energetical work.
Sprememba prehrane, detoksifikacija in vzpostavljanje novega energetskega pretoka.
Yeah. So just briefly about nutrition. I'm a big fan of the oil protein diet.
Nekaj o nutricionizmu oziroma prehrani. Osebno je gospod Hirnese privrženec maščobno-beljakovinske diete dr. Johanna Budvig.
First of all, of course, because I was a student of Johanna Budvig.
Bil je študent dr. Budvigove.
But second also, because the oil protein diet is so easy.
Poleg tega je pa tudi drug razlog, zakaj mu je tako všeč, ker je ta dieta tako enostavna.
And it's very close what people normally eating.
In je zelo podobna temu, kar ljudje normalno jemo.
Because, for example, the Gerson diet is also a very good cancer therapy.
Garson dieta je ravno tako zelo dobra
But
terapija.
in Gerson diet you are drinking 13 fresh pressed juices every day.
Ampak pri tisti dieti na dan piješ 13 sveže stisnjenih sokov.
But this is very good working, but far away what normal people normally eating.
Sicer ta dieta zelo dobro deluje, vendar je daleč od tistega, kar ljudje običajno jemo vsak dan.
So, what is the oil protein diet?
Kaj je maščobno-beljakovinska dieta?
There is one basis recipe. It's just a mixture between quark, flaxseed oil and milk.
V bistvu temelji na mešanici skute, laninega olja in mleka.
And the most important thing is you have to mix it before you eat it.
In najboljša stvar je, da jo morate zmešati, preden jeste.
So you just can't drink flaxseed oil and eat some quark. This is not working.
Ne morate samo, da bi posebej lanino olje pili in posebej jedli skuto, morate se skupaj zmešati.
And the rest of the oil protein diet is, let me say, a nearly normal vegetarian diet.
Poleg tega, kar smo zdaj omenili, jeste samo še neko običajno vegetarijansko dieto.
So it's not that difficult at all.
In ta dieta ni nikakor težka.
And some people maybe they're only doing it because, as you can see, sometimes for some patients they must drink champagne.
Nekateri se že posebej radi, ker je zraven lahko pijete tudi šampanjec.
But unfortunately not all of them, okay? Only for a few. By the way, you know why champagne?
Veste, zakaj šampanjec?
Because, you know, a tumor is taking a lot of glucose, sugar out of the blood.
Ker tumor jemlje veliko glukoze s krvi, sladkorja.
But in alcohol, especially in champagne, because champagne goes faster to your blood, there is is also sugar, but this kind of sugar your tumor can't take.
No, v šampanjcu, ki se tako zelo hitro absorbira v kri, je pa veliko tega sladkorja, ki ga pač potrebuje.
So you can give with alcohol somebody a lot of energy, but the tumor can't take the energy.
Daje veliko energije, vendar tumor do te energije ne more. No, pravzaprav šampanjec ima ta sladkor, ki ga tumor ne more izkoristiti.
Yeah, the next very important point is detoxification.
Druga zadeva je detoksifikacija, razstrupljanje.
And here there are three main points.
Tukaj so tri glavne
The first is the colon.
Prva je črevesje.
You have to clean the colon and you have to find a new system with the right bacteria in the colon.
Najprej treba očistiti črevesje in potem vzpostaviti neko novo ravnovesje z novimi bakterijami v črevesju.
So you can do this in different ways with enemas, with colon hydro, with eating bacteria, with doing bacteria with enemas. It doesn't matter how you do it, but this is what you have to do.
To se lahko dela na razne načine, z raznimi kristirji, z uživanjem raznih bakterij, z kolon hidroterapijami in takimi stvarmi.
The next important point is the acid, alkaline or acid-base balance.
Druga pomembna stvar je ravnovesje med kislinami in bazami v telesu.
So what you have to do is you have to bring the acid out of your body.
V bistvu je treba razkisliti organizem.
And one of the most easy, the most cheapest and best way is just doing a baking soda bath.
Ena od najbolj enostavnih stvari, da to naredimo, je kopel iz sode bikarbone.
So you just take 100-150 grams of this baking soda bath or different kind of salts. You do it into the water. The water is 38 degrees and you stay for 20-30 minutes in the bath.
Vzamete 100 do 150 gramov sode bikarbone, vsujete avokat, ki ima 38 stopinj Celzija in ste pač v tej kadi 20 do 30 minut.
So you do the toxin out and at the same time you have a fever therapy.
Na ta način vlečete v bistvu ven toksine iz svojega telesa, hkrati imate pa še vročinsko terapijo.
But what is the problem with this bath?
Kaj je problem s to kopeljo?
It's so nice and so cheap.
Tako prijetna in tako poceni.
And when it comes to cancer therapies, the patients are always thinking, oh, it must be painful and expensive.
Ko pride do terapij raka, pacienti vedno mislijo, da mora biti boleče in drago.
And the next thing is the teeth are very important.
Naslednja stvar so zobje.
So if it's possible, do the amalgam out.
Če je le možno, je treba iz zob dati amalgamske zalivke.
But never go just to a dentist and say to him, do my amalgam out.
Vendar ne iti k zobozdravniku in mu reči enostavno odstranite mi
Because if the
amalgamske zalivke.
dentist is not knowing what he is doing, you have after that more poisons in the body than before.
Ker če zobozdravnik ne ve, kaj dela, boste imeli potem še več strupov v svojem telesu kot predtem.
But even worse than the amalgam are the root canals.
Še slabš kot amalgam pa so te zobni kanali oziroma zobne korenine.
Because if you have a dead tooth in your mouth, you will have a lot of bacteria which are creating a lot of toxins into your body.
Če boste imeli v ustih mrtve zobe, se tam okrog nabira veliko bakterij, ki potem nekako ustvarjajo neke toksine, ki krožijo po telesu.
Sometimes I have seen really wonders just because I said to somebody do 1, 2, 3, 4 of the teeth out. And 2 days later he was a different person.
Gospod je videl prave čudo, že ko so se zgodili samo zato, ker so ljudje par zob si izpulili. V parih dneh je bila situacija s določenim pacientom povsem drugačna.
And this is not only with cancer.
In to ni samo primer za raka.
I had a patient with arthritis in the knees
Tudi pacienti z artritisom v kolenih
and prostate cancer.
in z rakom recimo prostate.
He did 2 teeth out.
Spulil si je 2 zoba.
2 days later he was totally free of pain. First time in 20 years.
Čez 2 dni je bil popolnoma brez bolečin, po 20 letih brez bolečin.
So when you have knee problems, it can be your teeth.
Če imate težave s koleni, so zato lahko razlog vaši zobi.
So it's not enough to do the toxins out. You also have to take care that not new toxins are coming in.
Ni pa dovolj samo to, da iz sebe izločite strupe, ampak morate tudi paziti, da ne vnašate strupe v svoje telo.